Mr. Khan 52 come to discuss his report with you, and doctor, I will be telling you interpreting that reports. Okay.
Mm-hmm.
I will be telling you reports. Okay. So you can start.
Okay. Good evening, Mr. Khan. My name is Dr. Rubina. How can I help you?
Doctor, I just wanted to discuss my report. Can you tell me what's going on with me?
Okay, Mr. Khan, give me a minute so that I have a look at your reports.
Okay, doctor. Doctor, patient says that ALT is 100 and AST is 70. Okay.
Mm-hmm.
ALP 180, normal is 40 to 130. Gamma GT is 220, normal is less than 60. Total bilirubin is normal and albumin is normal. The total protein is normal. INR is normal. Okay. Full blood count normal. All other pictures are normal.
Okay. So, Mr. Khan, may I ask why did you do this report?
Doctor, I was feeling tired in myself, and I was thinking that maybe I'm having some issue with my um, uh, my liver, so I just took this one.
Mm-hmm. Okay. Mr. Khan, can you tell me since how long you are having feelings of tiredness?
Doctor, I was feeling tiredness almost now going to be 1 year on and off, but I used to take the multivitamins and other thing. I used to get better. But this couple of 3 to 4 months, doctor, I feel continuously that I am not able to digest the things, and I was feeling some sort of heart burning sensation. So I thought to
Mm-hmm.
take this blood. So I did this report, doctor.
Okay, okay, Mr. Khan, can you tell me, do you have any tummy bloatiness along with taking food?
Oh yes, of course, doctor. Whenever I'm taking this food, so I'm getting this tummy block.
Mm-hmm. Have you ever vomited?
No, doctor. I feel at some time nauseated when I'm taking beef or something, doctor.
Mm-hmm. Okay. Okay. Do you have any fever?
No, doctor.
Anyone has noticed yellowing of your eyes or skin?
No, doctor.
Okay. What about your bowel movements? Are you having regular bowel movements?
Yes, doctor. Sometime I get constipation.
Mm-hmm. Okay. Okay. Can you tell me, are you feeling more cold than the others people do?
No, doctor.
Okay. Do you have any chest pain?
No, doctor.
Any shortness of breath?
No, doctor.
Okay. Do you have any swelling of your feet?
No, doctor.
Any puffiness of your eyes?
No, doctor.
Okay. Mr. Khan, can you tell me, do you have any long-standing illness like high blood pressure,
No, doctor.
high sugar?
No, doctor.
Have you traveled recently or previously any area?
No, doctor.
Okay. Do you have any liver disease previously diagnosed case like
No,
any liver disease?
no, doctor.
No. Okay. So, Mr. Khan, what do you do for your living?
Doctor, I'm working in restaurant.
Mm-hmm. Okay. And how your work is?
Doctor, work is stressful. Always I have to do 12-hour shift.
Mm-hmm. Okay. And what do you how to whom you live with
I'm living with my wife.
and how the things at your home?
Doctor, everything is good.
Mm-hmm. Okay. What is your typical diet?
Doctor, I'm eating everything. Mostly I'm taking it from restaurant. Mostly the grill item, doctor. I like the cheesy items.
Okay, okay. May I know your weight according to height?
Doctor, my BMI is 33.
Mm-hmm. Are you doing any physical activity daily?
Yes, doctor. Sometime every week I'm going for one time to badminton.
Mm-hmm. Okay, okay, that's great. So, do you take alcohol?
Yes, doctor. I take alcohol every day.
How many units and for how often?
Doctor, I'm crossing mostly 20 units per week.
Mm-hmm. Okay. Have you ever thought that alcohol is the first thing that you need to before breakfast?
No, doctor, not breakfast. Mostly at meal time, at dinner time, I do want to take because I feel tired most of the time. So I just wanted to relax myself. I take it.
Mm-hmm. Mm-hmm. Okay, okay. Okay. Apart from that, are you ta smoking?
No, doctor, I don't smoke.
Mm-hmm. Okay. So, Mr. Khan, what do you think? What is the cause of your tiredness?
I think maybe stress or some lack of sleep in making me tired, doctor.
Mm-hmm. We will discuss it. So, what worries you most about your report?
Doctor, I
As
just
you
want,
already said that, yeah.
but doctor, I was checking on ChatGPT. It says that abnormal LFTs can be because of cirrhosis or liver cancer.
Mm-hmm. We will discuss it, Mr. Khan, for you. And how can I help you?
Doctor, just wanted to know if
Apart
alcohol
from
is.
discussing this report. Yeah.
Yes, doctor, I wanted to know if alcohol is to be blamed or maybe whether I have to stop it completely.
Okay, sure, we will discuss. So, how it's affecting your life?
Doctor, I'm feeling tired all the time, so I'm unable to focus my work. And I'm working in the restaurant
Mm-hmm.
as a, main chef.
Hmm. Yes, I can understand. So, Mr. Khan, let's sum up. You said that you have done your reports for liver function test because you
Mm.
feel tired since long, and you want me to read this report for you, and you are worried about liver problem, and you have concerns about your alcohol intake. Is it all, or you want to add something?
That's it, doctor.
Okay, and Mr. Khan, may I examine you?
What you want to examine, doctor?
Yeah, first I will sanitize my hand and then I'll want to have a look at your hands for your any palmar edema, jaundice, pallor, and also clubbing. And I will ask
Mm.
you to do aesthetics, flapping tremors, extend
Mm.
your hands and keep it in an extended position. Then I would like
Mm.
to check your pulse, temperature, blood pressure, eyes for pallor and edema, collar size, and your waist size, your tummy for any hepatomegaly, and some spider nevi or any rash on the body, and ankles. Is there any finding?
Examination normal.
Okay, Mr. Khan, I want to run few test modes. Is it possible for you to
What you
do
want to run,
some
doctor?
tests? Yes, as your BMI is 33, I want to have some fasting lipid profile and HbA1c. Also, I want
Mhm.
to have ultrasound of your liver.
Okay, doctor, all pending.
Okay, Mr. Khan, as your report and the history you have given me, most probably you are having condition called alcoholic liver disease. Do you know about it?
No, doctor, what is this?
Yeah, as your alcohol intake is more than safer limits like 14 units per week, and your liver enzymes are elevated, especially gamma GT and alkaline phosphatase, I am concerned that your liver has to work harder than normal. Okay, are you getting my point? And
Sure,
maybe it's
doctors.
because of your alcohol intake.
So,
So
doctor,
it
I'm going
is
to stop
better.
suddenly. I can stop suddenly, doctor.
No, no, Mr. Khan. How about cutting down the units in a safe limit slowly and gradually? Because liver, if this the time you are lucky that liver changes can be reversible. Otherwise,
Okay,
if
doctor.
you continue, you are taking alcohol, then liver
Mm.
changes becomes most problematic, and it may end up in a liver cirrhosis, which is irreversible liver function. Okay.
Okay, doctor.
So first of all, Mr. Khan, we need to add thiamine into your a thiamine supplement like vitamin B1 25 milligram. How about taking this tablet for a few days?
For what it is, doctor? What is the reason of this giving this medicine?
Yeah, sometimes because of reducing the alcohol intake, as you are taking alcohol in a upper limit, so sometimes there is deficiency of this vitamin and it may appears in the form of some confusion and balance problems and something like that. Although you have
Mm-hmm.
not it, but it's better to be taken in a diet, add in a diet or as a supplement.
Okay, doctor.
And
Oh.
we need to consult
Time up.
you with a specialist.
Well done, Dr. Rubina. You've gone through. Case is passed, but let me if you add on few things. For the examination part, Dr. Rubina, we have to be more in a with sequence. For example, Mr. Khan, uh, may I examine you? Doctor, what do you want to examine me? Mr. Khan, first of all, I wanted to, I'm requesting you to please lie down on the couch and with the complete privacy. I'll be exposing your abdomen till, chest or nipple area, okay? So proper exposure. It should not be chest exposed, okay? In that case followed by Mr. Khan. Can I see your hands? So patient is lying down in 40 or 45 degree, but when you're going to check that abdomen, so you are going to make the patient straight. Okay. Many times you will be, there is a agenda in the examination. They will be keeping the patient position 40 or 40, 60 degree. Okay. So if you are examining on that position, no matter you did a correct examination, examiner will not give you a passing. The reason because examination technique was not correct. Because patient position was not appropriate to examine that viscera or whatever you're going to see. Huh? Now, Mr. Khan, I'm taking your pillow from the neck. Is it okay for you? Are you comfortable? Yes, thank you. So after doing general physical examination, you check the patient's hands, clubbing, everything, pulse, blood pressure, temperature, respiratory rate, saturation, weight according to the height you verbalize. Okay. After that, you say that I'm going to check your lumps and bump at the end of the examination. Here, it is not possible to do the lumps and bumps to do check in that position. So you can say that I will be checking at the end of the examination. Okay. Now you are going to inspect the abdomen for the scar, for the stripe, for any discoloration, or any spartaneria, whatever you verbalized just now. Huh? After that, Mr. Khan, I have already sanitized my hand. I'm just going to palpate your abdomen in a fashioned way that if in case, do you have any abdominal pain, Mr. Khan, right now? No. Okay, thank you, Mr. Khan. So you have to start from left iliac fossa, start up. There are some examiner, they are preferring nine quadrants. Some examiners are saying four quadrants are there. Both are correct. Okay, this is based on examiner preference, but you see how to see make a S shape. Okay, start from up. Okay, and while you touching the patient abdomen and palpating, look at the patient face. Okay, that this superficial palpation you're going to do it, not you're going to palpate deeper. Okay, now when you are going to see the liver or spleen, so in a case you wanted to see in a way that you are going to palpate little bit deeper, and you have to tell the patient take deep breath and then palpate and leave it. Okay, look at the patient face. And once you have done this deep palpation for the viscera, deep palpation not for every whole abdomen, okay, only for the viscera. Okay, now if like say you are going to percuss, so for percussion there is a rule. For the liver you have to start from fifth and second above the nipple you have to start, and where you feel the dullness you have to leave. Now you mark that upper border, huh? Same goes to the lower border. You have to start from down and come up. But for spleen, if you want to do it, you have to start from right iliac fossa, go towards the umbilicus, and go in vertically, go up to spleen and see. This is your percussion. You can put the stethoscope for that, listening bowel sound or whatever, so on. But if patient with gastric problem, only an acute problem, if you're putting stethoscope on abdomen for the auscultation, this is a pitfall. You will be losing the station. You will not be passing the station because that one we call improper technique. Okay. Now, in this scenario, the important cause the patient was asking and expecting that how to cut down the alcohol. Very well explained, Dr. Robina. So you have to discuss in that way, and same time you can say that I'm giving you this leaflet also. There are more other details are there. So we will be discussing. If, like, say, for example, if you have any questions and query, you can come back to me. Okay, now exercise, weight loss, the weight management or diet, whatever so on, you can discuss. But cutting down the alcohol one shot means, like, say, this is a blunder in the exam, so you should avoid. Okay, smoking, yes, he can stop abruptly, but alcohol, if he's taking more than 14 units per week, so we have to stop slowly and gradually. Okay, so one. Number
Yes.
two, yes, doctor. Number two, if patient is a non-alcoholic, you will be referring for the fibroscan in 3 years, I think I'm not mistaken. But if patient is an alcoholic, is suspecting alcoholic fatty liver disease, you should not say the fibroscan. Fibroscan is not for the alcoholic liver patient because this patient is already liver damaged by the what you call it, damaged by the alcohol. So, give me 1 minute. Okay, so this is the one. Okay, now Dr. Ruhullah and Dr. Sadaf, I think they are going for exam. Am I right, Dr. Ruhullah, Dr. Sadaf? Anyone is available now?
Yes, sir, I'm here.
Okay, Dr. Sadaf, can I say, can you speak louder bit because I'm not able to get your. Give
Okay,
me
is it
one
fine
second,
now?
doctor. Yeah, fine, doctor.
Okay.
Okay, Dr. Sadaf, your patient is 72 years old, Mr. Usman, come to discuss his problem with you. Take proper history, examination, and management plan. Okay.
All right.
So, start.
Good evening, Mr. Usman. My name is Dr. Sadaf. How may I help you?
Doctor, for the last few weeks, I have been so stiff and aching, especially in the morning. It's really getting hard to get out of the bed.
Okay, can you tell me more about your problem?
Doctor, I'm facing this problem on and off since longer time, but the last 6 to 8 weeks, doctor, it's been worsened. And I'm feeling that my whole body is stiff and aching.
Okay, I'm so sorry to know about your problem, Mr. Usman. Is it okay if I ask you a few questions?
Sure, doctor.
Okay, so can you tell me which part of the body is more stiff when you wake up?
You mean to say you are talking about my, okay. Mostly I'm struggling with my arms when I'm brushing or reaching up to the cupboards. Specifically, I'm getting difficulty while getting out of the bed in the chair, while slowing up in the dressing, and many things, doctor. I can't put my undergarments, doctor. And this whole body is aching, especially my shoulders and my upper arms, doctor. My thighs and my hips getting up from the chair really bad.
Okay, so can you tell me how long does this stiffness last when you wake up in the morning?
Doctor, it's like mostly get better with the time, but morning time I really get better worse. Okay, and it's almost 1 to 2 hours I have to struggle myself to loosen up my body.
Okay. Uh, all right. Okay, Mr. Usman. So, do you have any pain anywhere else in the body?
No, doctor.
Okay. And do you think that your movements have also slowed down?
You mean to say my walk? Morning time I
Yes.
feel difficult. I feel difficult morning time, and after that I feel much better.
Okay. Do you have any headache with this?
Mild sometime.
Okay. And do you have any other long-standing illness?
Well, doctor, I'm having high blood pressure. I'm taking this tablet, amlodipine. I have osteoarthritis of the knees for several years.
Okay. And what medications are you taking for that?
Doctor, I'm taking only paracetamol.
Okay. And how are you doing with this?
Doctor, I'm doing good with that one. I'm just surviving, but this pain is little different than doctor that I do have as a osteoarthritis.
All right. Mr. Usman, do you have any fever?
No, doctor.
Any weight loss?
Well, you talking about weight loss. I lost 2 to 3 kilo over the last couple of months. Maybe, doctor, I'm moving less, or maybe I'm eating less there. Maybe can be that one.
Okay, we'll discuss that later. Okay, so do you have any family history of any illness?
Doctor, my mother had arthritis in the old age. Likely, maybe she's a osteoarthritis. Maybe.
Okay, so Mr. Usman, do you know about your weight according to your height?
No, doctor, I haven't checked, but I feel that I lost my weight because my shirts are getting loosened up.
Okay, okay, so what do you do? Are you a retired person?
Doctor, I am a retired person, but currently I'm taking care of my garden actually.
Okay, and who lives with you at home?
Me and my old lady.
Okay, do you have kids?
They grown up, doctor. They are living abroad.
Okay, I see. So everything is okay at home?
Yes, of course, doctor. Everything is okay.
Okay, that's great. So what kind of a diet do you take?
Whatever my wife prepare, doctor, I eat everything.
Okay, and besides gardening, any other activities that you are doing?
Yes, we both go for a walk outside and go here and there.
Okay, that's great. Okay. So, do you feel more tired after walking?
Yes, doctor.
All right. And what about your mood these days?
I feel better, annoyed and frustrated because of this pain, doctor. It's early morning. I have to get the first thing I have to get this pain only.
All right. So, what do you think about your condition? What might be going
Doctor,
on?
I'm thinking that, doctor, I thinking might be just an old age or maybe my arthritis getting worse.
And what worries you the most?
I just worried about getting something serious like the rheumatoid arthritis or muscle wasting illness.
All right. And how do you want me to help you?
Doctor, can you give me some sort of reason and medicines to see that what's going on with me?
Yes, sure. I'll try my best to help you. And okay, I can see that this must be impacting your daily life. So, Mr. Usman, let me sum up for you. You told me that you have muscle stiffness and pain in your arms and your thighs and hips since 2 months, and
Hmm.
you want to know what might be causing it, and you want some medication for this. Is that all?
Yes, doctor.
Okay, may I examine you?
What you want to examine, doctor?
Okay, in complete privacy, after sanitizing my hands, I would inspect and palpate I will touch the muscles of your shoulder. And
Mm-hmm.
can you raise your both the arms above your head? Are you able to do that?
Mm-hmm. Okay, doctor,
Okay.
getting pain, doctor, little bit pain.
Okay, okay, I'm so sorry. Okay, you can get it down. Okay, I'll also check your
Doctor,
feet
give me
for
1 minute.
relief.
Doctor, give me 1 minute. Yes, Dr. Sadaf, please continue. I got call.
Okay.
Examination continue, doctor.
Yeah, I will check the power of your upper and lower limbs, and
Mhm.
I'll palpate your scalp and your temporal area for any tenderness. Can you open your mouth? And is there pain anywhere?
Yeah, doctor, it's okay for me. Temporary, I don't have pain, but I have pain in the shoulder, doctor.
All right. Okay, that's it. I think that's all.
Okay, doctor's examination, rest of the examination normal except reduced abduction and flexion in the both shoulder due to pain and stiffness. Patient resisted. Okay, hip pain and stiffness on active hip flexion, difficulty rising from the chair without using arm, and gait slightly stiff. Rest of the examination is normal.
Okay, so Mr. Usman, I need to offer you a few investigations to
What you
confirm
want
my
to do,
diagnosis.
doctor?
I would send your CBC and CRP, ESR, uh, and your RA factor. I think that's all.
Okay. ESR 70 raise, CRP 40 raise, full blood count shows normal, mild normostatic anemia, platelet normal, urea electrolyte everything normal, rheumatoid factor anti-CCP negative.
Okay. All right. So, Mr. Swan, after listening to you and examining you, what I think the condition that you're suffering from is something that we call polymyalgia rheumatica.
Oh,
So,
okay.
it's a condition that causes inflammation in the large joints and muscles of your body, and
Mm-hmm.
it is a long-standing condition, and we can control the symptoms and the pain. All
Mm-hmm.
right. So, is it okay if I start you on a medication for this?
So, doctor.
Okay, I would start you on tablet prednisolone 15 milligrams for a week, and
Mm-hmm.
I would want you to come back to me for after a week so we can see how the symptoms are progressing. And it might take quite a lot of time to recover. It might take up to a 1 year. All right, and in due
Mm-hmm.
time, we'll be also doing your FRAX score to see if, because this steroid tablets, they might cause some thinning of your bones. So we'll do
Mm-hmm.
your FRAX score and DEXA scan, and
Mm-hmm.
I might need to refer you to the specialist.
Mm-hmm.
All right. So can you come back in 1 week time to see the progress?
Okay, doctor.
Do you have any questions?
No, doctor.
Okay, if at any time you think that your pain is getting worse or you have any pain in your any headache or any vision changes, then please come back to the hospital earlier.
Okay, doctor.
All right. Okay, thank you for coming, Mr. Usman.
Thank you, Dr. Sadaf. Well done. I don't have to comment much, but just simple thing. Just wanted to say that when you are going to explain that what is this problem, so you have to take little bit pause. Okay, and do you have idea what's going on with you? Okay, do you know what is this polymyalgia rheumatica? Okay, so here you are going to engage the patient while explanation. Okay, uh, that is. More appropriate to ask. Okay.
Okay, all right.
Okay. So otherwise, I don't have to talk much on that one because it's you have gone through each and every touch point. Specifically, you talk about red flags and other things. So I'm okay with it. Dr. Rohula, are you ready?
Thank you, sir.
Okay. So anyone else is going for exam this February? Okay, Dr. Kumar,
यस सर.
ready
हाँ
for the
बेटा उसमें
case?
बुलाया. यस सर रेडी हूँ.
So,
आप 10 मिनट वेट करो बुलाएगा. हाँ. यस
okay,
सर
Dr.
रेडी.
Kumar. Okay, your patient is Mrs. Laila, 24 years old female. Come to discuss her problem with you. Take proper history. Manage the patient. Examination is not required.
एग्जामिनेशन नोट रिक्वायर्ड. ओके.
Yes. Okay,
ओके
Dr.
सर.
Kumar.
टाइम टाइम स्टार्ट.
Okay, doctor, start. Start.
Okay, hello, I am Dr. Kumar, one of the GPs here. Am I talking to Mrs. Leila?
Yes, doctor.
Yes, I can see through my note that you are coming here for some concerns.
Yes, doctor.
Yes, I am Dr. Kumar, one of the GPs here. So please tell me more about this.
Doctor, I'm having this pain lower down in my tummy for a few days, and it's getting worse now.
I am really sorry to hear about that. Are you comfortable talking to me right now?
Yes, doctor.
Okay, so please tell me more.
Doctor, I'm having the tummy pain here, my lower tummy area, in my
Mm-hmm.
center and my both side, just above my this pubic area. It's getting more at right side, doctor. It's been 5 to 6
Mm-hmm.
days. It's not going away,
Mm-hmm.
doctor.
Mm-hmm. Anything more you want to tell?
Doctor, it's like say something like say, crampy aches, or there's sometimes I'm getting
Mhm.
sharp
Okay.
twinkles kind of stuff, doctor.
Okay. Has it gotten worse since it started?
Uh, no, doctor, but some points I'm getting problem when once at walking fast,
Mm-hmm.
going over the bumps in the car,
Mm-hmm.
and when I'm having intimation, doctor, that time I feel problem.
Okay. And can you, as you mentioned, it is on the front side or it is the back side?
Front side, doctor.
Front side. Okay. And can you rate the pen with the one with the least and the 10 with the high, more pen?
Doctor, it is 6 by 6 to 7, and with activities, it is getting more and more, doctor. It's
Mm-hmm.
unbearable.
Okay. And have you taken anything to get relief?
Doctor, I took the paracetamol, but not helped.
Mm-hmm. Okay. And I forgot it. How old are you?
24, doctor.
Okay. And I need to ask some questions. Is there any pain apart from this, anywhere in the body?
No, doctor, I am having this problem only.
Is there any problem in passing stool?
No, doctor.
Any bleeding from the front passage?
No, doctor, except I am menstrual cycle, I don't have any bleeding.
Okay, and do you have any, do you feel that your abdomen is getting bigger, like any swelling?
No, no, doctor.
And how has been your appetite?
My appetite is good, doctor.
Mm-hmm. And is there any change in the skin color?
No, doctor.
Any itching?
No, doctor.
Is there any recent change in the weight?
No, doctor.
Okay. Okay. So is there any nighttime sweatings?
No, doctor.
Okay. How about waterworks?
Sorry?
Waterworks. About urinary, is there any urinary problem?
No, doctor.
Okay, so
Sometimes I'm
have you,
getting painful urination. Couple of times, but
Mhm.
not prominent, doctor.
Okay,
When I'm
so
drinking less
okay, so
water.
mhm. Okay, so have you been okay, so has this happened for the first time?
Yes, doctor, this happened first time to me.
Okay, okay, so some questions regarding your past medical history. So do you have any long-term medical condition
No, doctor.
like high blood pressure,
No, doctor.
high blood sugar,
No, doctor.
any kidney problem, stone
No,
problem?
doc. No, doctor.
Okay, okay, so what do you do for the living?
Doctor, I'm a university student.
And how is the study going on?
Going good, doctor.
Is there any stress nowadays?
No, doctor. Everything is good.
And how is your diet?
My diet is good, doctor.
Okay, so what about water? Drinking water? How often do you drink?
I'm taking enough water, doctor.
Okay, okay. Some question regarding personal habits. Do you smoke?
No, doctor.
What about alcohol?
No, doctor.
Okay, so some questions, some sensitive question I am going to ask. So, do you have are your periods irregular?
Yes, doctor.
Okay, so is the how when was the last menstrual period?
Doctor, my last menstrual cycle was 2 weeks ago.
And are you in any relationship?
Yes, doctor.
And are you using any pills?
No, doctor.
Okay. Okay. So some I need to. Okay. So Mrs. Lila, you mentioned that since 4 to 5 days that you are getting pain in the front of the in the middle of the abdomen, above the pubic area.
Hmm.
And it is getting worse since then. So anything going across your mind? What could be the reason for this?
Doctor, I thought maybe because of bad period or urinary infection, but the pain has lasted beyond the period, doctor.
Mm-hmm. Okay. And anything worrying you?
Maybe something serious, doctor, in the womb. Maybe ovaries. My ovaries are not healthy.
Mm-hmm. And why do you think like that?
Doctor, I was reading on Google that if, like, say, ovary is not good, I will not be getting fertility. I don't have never got pregnant, doctor, before, so I'm just scared. Once I
Mhm.
will get
Okay.
married, doctor, it will be problem for me.
Mhm. Okay. And what do you expect from me today?
Doctor, I just want a proper checkup, maybe some scan or
Sure.
test.
Sure. So, okay. So, in order to have better understanding of your condition, I need to check your observations, your vitals, blood pressure, respiratory rate, and also do general physical examination. Also, I shall do with more focus on the abdomen. I shall also
Examination not required.
examine not okay. I also want to do some bedside test, which is include pregnancy test, urine dipstick, urine
Hmm.
dipstick test. Yeah,
Okay.
and blood sugar test.
Okay. All investigations pending.
Oh, pending. Okay. Okay, based on the information which you provided me, I think I'm not sure at the moment that what could be the reason for this pain. So I'm going to refer you to the hospital. Is that okay?
Okay, for what, doctor? Why, doctor,
So
you
I'm
referring me hospital?
yeah. The thing is that as I'm awaiting the reports, I want to do some gel scan of your abdomen. Mm.
Why, doctor? So
So
I have
there.
to go. Why I have to go hospital?
Yeah, the thing is that there might be some reasons. Maybe you have might have some stone in your kidney. There might
Uh-huh.
be some. As I'm awaiting your pregnancy test as well. So
Pregnancy test
um,
negative.
okay, so okay, so I'm going to refer to hospital to do a gel scan of your kidney because the pain you are telling it might be probably due to the kidney stone.
Okay, but doctor, are you giving me any medication, doctor?
Yeah, I'm going to give you medications. Do you have any medicine allergy?
No, doctor.
Yeah, so I'm going to give you injection diclofenac 75 milligram intramuscular. So this will help you relieve some pain.
Doctor, I don't want painkiller, I want intramuscular. Anything else, doctor?
Yeah, orally, can you take orally?
Yes, doctor, it's okay.
Yeah, so I'm going to give you diclofenac tablet. Please eat it after eating some biscuits or something like that. Okay, so how you came here?
Doctor, I came with my friend.
Okay, so I'm going to arrange a transport for you so that you can go to hospital. And in between this transport, if you feel that your pain is getting worse, immediately brief the nurse so that she can attend your pain. And I'm also giving you a leaflet about this condition. So if you have any other questions later, you can come to discuss with me. Is that okay?
Okay, doctor.
Okay, so after discharge from the hospital, you can come to me again to
Doctor,
discuss
yeah,
again.
why I'm going to get admitted in hospital, doctor? This is a
No,
problem.
no, I'm not going to admit you hospital. I'm going to do some gel scan, ultrasound scan of your abdomen to rule out if I'm
Doctor,
not missing anything wrong.
okay, doctor.
Mm-hmm.
Okay, doctor.
Yeah. So, do you have any questions so far?
No, doctor.
Oh, okay. Thank you for the consultation.
Okay, Dr. Kumar, still you have 1 minute.
1 minute. सर क्या था डायग्नोस बता दें फिर मैं आगे बढ़ूँ.
This is pelvic inflammatory disease, actually. Just give me,
Oh
doctor.
shit.
I will call. I've got one call, doctor.
Oh, okay. आ जाओ आ जाओ. हाँ, हाँ, बैठो बैठो. क्या नाम है?
Dr. Kumar, first of all, my friend,
Yes sir.
your history is one of best history you're going to you're taking. But few things, as a being a we when we are in practice, no, so we
Mm-hmm.
still go into in a judgmental way, no. So when we are going to judgmental way, so we missed it. Why a judgment is checked by the examiner in the exam as per the standards? You know why? Because when we are doing judgment, for example, if one case come to me, I'm just giving example. Um, Patient come with a cough. Nowadays, influenza season is going on. I'm saying, "Good, no, it's okay, no problem, it's influenza." But I didn't ask about travel history. I didn't ask about any hotel stay. I didn't ask about any jungle trekking or mountain hiking or something, whatever so on. Or patient had a long haul flight, maybe having some pulmonary, sorry, this DVT, or maybe patient had some sort of vascular disease because I didn't ask about past medical history. So I'm going to miss many things, no? Patient come with the pain, always go with the Socrates. Socrates means like say it will be a site. Where is the pain? Patient told already. Onset, she told already. Character, she told. Severity, you ask. Radiation, you didn't ask. Here you missed the whole boat. You went out off track through and through. You know why? Because radiation sometime into the lower back and mainly in the central area. Timing where? Okay, constant background ache is keep on coming. Worse with the movement and during intimacy. Okay, aggravated patient told already, relieved the paracetamol she told already. Now here we come. Do you have any front passage discharge? Yes, doctor, it's been worse now, 1 to 2 weeks now, more than usual. It's what color it is? Yeah, doctor, it's yellowish, creamy, sometime with a slight odor. Is there any itching? You asked already. Now bleeding, you may ask already. Very well done. Okay, now she is feeling fluid, tired, washed out for the last few days. You fever, you asked already. Mild nausea, okay, and urinary symptom, you ask. GIT symptoms, you didn't ask, okay. And now menstrual cycle, you very well ask about pregnancy, you rule out contraception, you rule out, well done. Okay, sexual history, you have to say in a way that this is very critical question in this case of scenario. So is there any, so it should be a non-judgmental way, okay? So it is very sensitive. So you have to take the permission, Mrs. Laila. May I ask you some few sensitive questions? You might feel discomfort while answering this one, but it is mandate. It is necessary to rule out that further about your illness for which you came to get the treatment. Okay. So you have to ask about in new relationships, since how long it is, or before him he had any other partner because she had one more partner before 6 months. Okay, and what kind of method mode they are using, then what kind of barrier method they are using. You ask about contraception, we have to ask about barrier method. Okay, male or female, whatever, so on, and she will be embarrassed to open up. But now here you have to take full confidence. Okay, in a way that I am taking. If whatever you are going to talk over here, it will be fully confidential. Past history, very well done. You ask. Drug history, you ask. Social history, in a way, you have to ask. Now, here your summary was good, but without taking the break, you went to the examination. Now, here you can say, Mr. Kumar, after summarizing Mrs. Laila, Miss Laila, may I examine you if there was an examination required? Now, here, what was the mistake here? It's not a mistake. It was just like say you overlooked actually. Examination outside written examination is not required, but you did examination. Okay. So here examiner will say you are not attentive. Okay. So incompetency they will be putting as a incompetent. So now here please take care of this thing. Now let's have a talk about uh, for the management plan, Mrs. Laila. You have to explain in a way, Mrs. Laila, from your symptoms and the symptoms. I'm suspecting that it looked like infection of the womb and your tubes. As you mentioned that you have the pain on both side of both side, but mostly you getting pain on the right side. Are you getting, Mrs. Laila? So you have to take the pause. You know what it is? I'm suspecting it might be a pelvic inflammatory disease. Do you have any idea about pelvic inflammatory disease? So you have to explain. You have to tell. It is usually caused by the bacteria passing up to the lower genital tract. It often comes from sexually transmitted infection like chlamydia or gonorrhea. Here, when you are ordering investigation, don't forget to say that I am going to do the examination. Going to check for your urine pregnancy test, dipstick, and I will rule out from STI is also okay. So you have to ask, you have to tell about the patient that I'll be doing your, full blood count, CRP, and I'll be doing, screening for chlamydia and gonorrhea. Not okay. Endocervical, I'll be taking the swab from high vaginal swab. Now here, examiner want to listen not vaginal swab, it should be high vaginal swab, endocervical. Okay, Mrs. Laila, this is not a blame. This is not about the blame and that you might got from there or here, but now it is our first priority to treat you. Okay, she might overcome to you. She say, "Doctor, do you think that my previous partner had so he was cheating on me, or this partner is cheating on me?" So here you have to be more cautious. You should not answer in a way, yes, maybe, you may not be. No, you say it is too early to say. Okay, about who is that one. But now our main focus to treat you as you are in the pain. Okay, now initial investigation in the primary management, as I told you that UPT, you're going to take the swabs, okay, urine dipstick, full CBC, CRP, if patient having some severity, okay. Now, make clear that I will be treating you empirically today rather than waiting for the results. Okay. So what doctor you're going to treat me? You can use a local STI guidelines, doctor, as per local guidelines. Okay. So for example, you can give ceftriaxone injection IM single dose for the gonorrhea cover plus doxycycline for 14 days for chlamydia and typical. Just I'm giving doctor, but please follow the local guidelines. Not, and I'm not to follow what I'm saying. Maybe my things are right, correct, but still you have to follow local guidelines. Okay, and metronidazole for 14 days for anaerobes. For example, if your practice is there, if patient is saying that I don't want IM injection, okay, then you can give some sort of oral antibiotics. Okay, again, it is as per that one, local guidelines. Key point in this scenario to start antibiotic today itself, don't delay. One thing, treat as per local recommended combination regime. Emphasize on completion of entire course. Okay, even if she feel better. Okay, pain control, you can give simple analgesia like say NSAIDs or maybe paracetamol. Okay, rest and avoid, intimacy with the partner until she and her partner get treated. Okay, so now let's talk about partner notification and sexual health aspect. That you can explain that we will be testing your current partner and treatment to avoid reinfection to protect their own health. Okay. Ideally, we are going to refer to the gum clinic or whatever store as per local guidance. Key advice: no unprotected intimacy until she got completely treated. Her partner have been tested or treated and cleared as advised by the services. Okay, be sensitive while when you explaining. Don't use judgmental approach. You have to take a non-judgmental approach. Okay, so safety netting, you can say that your symptoms will reduce. Your symptoms will reduce within 48 to 72 hours after starting the antibiotic. Okay, your discharge may take little bit longer to settle. Okay. Okay, and followed by you have to seek urgent help if your pain is not getting better and plan follow-up in 48 to 70 out of 72 hours. Okay, so that's it. Dr. Ruhullah, oh sorry, Dr. Jannat, you are the one who is next patient. Doctors.
Sir, thank you very much for the feedback. Thank you very much. Sir, can we say the genital urinary medical clinic we want to refer, or we shall do contact tracing by in our the GP surgery?
No, doctor, again, I'm telling you, this one you have to follow as per local guidelines, doctor.
Sorry, which guidelines?
Local guidelines, doctor, our local guidelines, like say
No, but
Pakistan
they follow
guidelines.
UK system. They follow UK system or South Asia system. I don't know
No,
about South
doctor,
Asia.
I have shared one file in the group. I think so that is a PDF file is there. So you have to follow that one. Okay, that
I
follow, it
didn't.
will be
Sir,
showing that.
sure. Can you please tell me means what need to do? We shall do contact tracing by ourselves, or we need to refer to a gum clinic.
And doctor, contact tracing, again, I am telling you in Pakistan, I'm not sure about because I never been to, never practice in Pakistan. So, but still, I have to tell you that I'm going to refer to the specialist. Infection control.
Oh,
Pakistan, you can say infection control, okay?
okay,
Not
done,
gum
done.
clinic.
Okay, done,
Okay?
done. Sure, sure.
Infection control will be more appropriate to talk about.
Done, sir. Got it. Thank you, sir. Thank you.
Okay, Dr. Horijanas, you are the one, doctor.
Okay, doctor.
So, doctor, your patient is, what is the name of the patient? Okay, Mrs. Nazia Khan, 52 years old, female, come to discuss a problem with you. Take proper history, manage the patient. Examination is not required. Okay, doctor, start.
Hello, Mrs. Nazia. I'm Dr. Hool. How can I help you today?
Doctor, I keep leaking urine and it's really starting to affect my life.
Okay. Could you tell me more about your problem?
Doctor, it's been 1 year now, and the last 3 to 4 months is getting worse, doctor.
Okay, Mrs. Nazia, I can see you are very stressed and I'm sorry to hear about this problem. So is it okay if I ask you a few more questions so that I can help you?
Sure, doctor.
Okay, so it's been 1 year. So
Yes, doctor.
for this 1 year, have you checked by any doctor about this problem?
Doctor, I'm feeling embarrassed to talk, but someone told that this new doctor is very good in the town. So
Mm-hmm.
I came to see you, doctor.
Okay, okay, Mrs. Nazia, I can see you are very embarrassed as well. So, Ms. Nazia, whatever you will tell me, it will be confidential, both of us. Okay.
Sure, doctor. Thank
So,
you, doctor.
okay. So, this leakage of urine, do you feel that whenever you have urge to pass urine, that time you are leaking?
Doctor, when I'm coughing, sneezing, when I'm running
Mm-hmm.
for the bus, sometimes I leak a small amount, and typically, you know, when I cough, doctor.
When you cough, okay. So, is the cough is with you all the time?
No, doctor, nowadays not cough, but last week I had a viral infection. I was keep on coughing, so I
Okay.
was keep on leaking, and I have to change my clothes every here and after.
Oh, I can see it's very much difficult for you, Mrs. Nazia. So apart from this leaking, do you notice the frequency of urine is it increase?
No, doctor, but sometimes I feel suddenly I need to go to the toilet, and I can't hold
Mm-hmm.
it. I
You
think
can't
that
hold.
I may leak on the way to toilet.
Okay, okay. And any burning in your urine?
No, doctor.
Any pain in your lower tummy?
No, doctor.
Okay. And how about your bowel movement?
My bowel movements are good. Every day I'm going to toilet normally.
Okay, okay. And may I ask you some personal question?
Sure, doctor.
When you have your last menstrual period?
Doctor, 2 years ago.
2 years ago. So, okay, so right now you don't have period. So
Yes, doctor.
before, do you use any sorts of contraception?
No, doctor, because
Mm-hmm.
me and my husband like children. So we have,
Oh,
6 children now.
okay, okay. And this all the children's, what about the mode of delivery?
Normal delivery, doctor.
All are normal delivery. Okay. So this that during the time of delivery, is there any complication all about the 6 children?
No, doctor. Uncomplicated.
Okay, uncomplicated. Okay, and uh, in your and right now, are you sexually active?
Yes, doctor.
Okay, and do you notice any discharge from your front passage?
No, doctor, I feel dryness and some discomfort while intimacy.
Okay, okay. Do you notice any bleeding in after intimacy?
No, doctor.
Okay, okay. Do you have any unintentional weight loss? Do you notice?
No, doctor, my weight is, I'm gaining weight actually. My weight is now 29 BMI.
You are gaining weight. Okay. So do you feel cold compared to others?
No, doctor.
Okay. And any night sweats?
No, doctor.
Okay, 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 Mrs. Nazia, apart from this leakage, do you have any other chronic illness?
Doctor, I'm having high blood pressure. I'm taking tablet amlodipine 5 mg 2 times.
Okay, and how about you? Are you taking the medication regularly?
Yes, doctor.
Okay, is my nurse check your blood pressure today? Is it control?
Doctor, my blood pressure down. Your nurse told that I have blood pressure 135/85.
Okay, okay, okay. Apart from this amlodipine, are you taking any medicine for any other reason?
No, doctor.
Okay, and do you have any high blood sugar?
No, doctor.
Okay, any history of any infection in your down below before?
No, doctor.
Okay, and what do you do for living?
I'm housewife
Okay, and whom do you live with at home?
with my children and my husband.
Okay, everything is okay in the home.
Yes,
And
doctor.
okay, okay. And do you, Mrs. Nazia, how about your diet? What kind of food you are eating?
Doctor, I'm eating mostly homemade food.
Homemade food. And how are you? Do you drink coffee?
Doctor, I'm taking 6 to 8 mugs of tea per day.
Tea per
And
day.
sometime,
Okay.
yeah, but sometimes taking fizzy drinks also.
Easy drinks as well. Okay, okay. And do you do any sorts of exercise?
No, doctor, don't get time.
Okay, okay. Do you smoke?
No, doctor.
Drink alcohol?
No, doctor.
Okay, Mrs. Nazia, anything crossing your mind? What could be the reason of this leaking urine?
Doctor, maybe my bladder is weak or maybe after having this children.
Well, Mrs. Nadia, I will come back to this point later, and I can see you are very worried about this leaking. Apart from this, any other particular concern?
Doctor, I'm feeling embarrassed. I can't go outside and I've just left the parties because of this problem. Because I can't laugh.
You can laugh. Okay, okay, but that means very difficult for you, Mrs. Nadia. And what exactly you want me to do for you today?
Doctor, I heard there is some sort of exercises are there and some treatment is there to help me on this problem.
Well, yes, sure. I will come back to this point later. And I can see these things are really impacting your daily life. You cannot go party and you are leaking. Apart from this, any other particular impact on your life?
No, doctor, that's it, doctor.
Okay, Mrs. Nazia, let me quick recap. You are having this leaking of urine for last 1 year, and it is really embarrassed because whenever you cough or laugh, it is getting leakage, and you think your bladder is weak because of the multiple birth, and you want me to help you by doing some exercises and giving you some medication. Anything else you want to add?
No, doctor.
Okay, so Mrs. Nazia, so far, what you have told me, it looks to me that you are having a condition which is called a stress incontinence. Do you have any idea what is it?
No, doctor.
Okay. So, okay, I will explain you. Whenever sometimes during the advancing age, our muscle which is supporting our bladder, it become weak and they cannot hold them. So whenever
So, doctor,
the
it's
bladder,
doctor, you say that it's incontinence?
yes, it's stress incontinence.
Okay, doctor.
Okay, so when sometimes whenever the muscles of our bladder it become weak, so that they cannot hold the bladder when the bladder is filled with urine. So the any pressure when come to the bladder, the bladder leaks the urine. So in your case, as you have told me that you gave birth 6 children, this could be a reason, and also you are drinking too much tea, at least 6 cups you are drinking, which could also a reason for this incontinence. Are you
Okay,
getting me?
doctor. Okay,
Are you
doctor.
getting me? Okay. So, and it now, so yes, what you are you are thinking it's because of the weakness of the muscle of the bladder. It's because of your multiple birth. It could be a reason. So don't worry. I know you are very stressed and you are very embarrassed because of the leakage of the urine. So we can manage this condition by some lifestyle modification, and there are some sorts of exercise also available for this. Are you getting?
Yes,
Okay.
doctor.
So first of all, what we can do first, we need to modify your lifestyle by doing some diet and exercises. It's very
Mhm.
important to reduce your tea consumption. Reduce by you can drink at least 1 to 2 cups per day, but not more than that. And also avoid all kind of fizzy drinks, especially after every day. And
Mhm.
it's very also important to do some sorts of daily exercise, at least 15 to 30 minutes per day, which is also help to reduce your weight as well. Because high,
Okay.
as your BMI is high, it could be also a reason. And uh, and there are some sorts of exercise available, which is called pelvic floor muscle exercise. So for that reason, is it okay if I involve you with the physiotherapy department?
Mhm. Okay, doctor.
Okay. They will help you. This is called some Kegel exercises. They will help you with this, how to do these exercises, and it will try to regain your strengthening of your pelvic muscle. Is it okay with you?
Okay, doctor.
Okay. Okay, and we will right now. There is you are very embarrassed because you if you
We
go
found it
party,
was
it
right
is
in the counter.
leakage. So what we can
We were
do
opposite. I said to put
in
the
this
counter
period,
plating. We paid for other card. I was like that.
uh,
Okay,
in this
time up.
period, okay.
So, doctor, first of all, in the history, patient had both earth and stress both. Okay.
Okay.
So this is we call it mixed, diagnosis. Okay. So you getting me, doctor?
Yeah, doctor, she's telling coughing
Yes.
time.
No, doctor. She told both. She having urgent continence also. She was running to the toilet.
Yeah. Yeah, yes, 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 yeah, you have told me. I forget. Okay.
Yes, doctor. Okay. So that was the agenda of this one to know about mixed picture. Okay.
So in that case, we will tell her both pelvic floor muscle and
Yes.
bladder training as well.
Yes, doctor.
Okay, okay. So she will do both, and after that, if it is not working, then we will start the medication.
Yes, doctor. And this was the agenda of this case to recognize that she is having mixed picture rather than only one picture. Okay. So one second thing, you gone through the history very well. There was nothing such thing missed. But when you talk about, you can say the explanation from your history. What I'm suspecting that you have the problem. So you are getting the problem we call it give me 1 second. My system was mixed.
How many ones you have?
Okay. You see, we have stress incontinence, urge and overreactive bladder, mixed incontinence, and overflow or functional causes are there. Okay. So from your history, she had coughing, sneezing, and running. Okay. So it means like say it is a stress incontinence. But sudden urgent urge with leakage before reaching to the toilet, increased frequency and nocturia, it will cause as a urge component. Okay. So in this patient, working diagnosis will be mixed urinary incontinence, stress plus urge. You can say mixed urinary incontinence.
Mm,
Okay. Okay, and
okay.
likely related to your pelvic floor weakness and overreactive bladder with the perimenopausal changes. And as I can see that you are taking coffee too much, and your weight also, it is a contributing factor. Here you missed one thing. Do you feel any pressure down below and down area? Okay, so she might be
Yeah.
having over, what you call it, what they say,
Prolapse.
uh, yeah, collapse.
Prolapse.
Prolapse, sir.
Yeah,
Prolapse.
prolapse. Prolapse. Okay, so So the thing here, when there is a mixed picture is there, so mixed picture always comes with a little bit more things. Okay, for that one, you are going to offer that urine you to rule out UTI first. Okay, glycosuria and hematuria. Okay, so you are going to check the urine analysis with urine dipstick and urine culture. You are going to send it. Okay, and then rest, especially you can go for you have to tell the patient at least you have to do take that diary for bladder diary. Okay, like say 3 days recording the fluid intake, widening volume, and episodes of organ leakage and pad usage. If like say that one, if like say you're facing. Okay, so one. Number two, doctor, initial management. First of all, in this patient, we have to talk in non-pharmacological. You very well explained. For the fluid management, weight loss, bladder bowel habits, smoking if patient is smoking and coughing if relevant. If patient having cough right now, so you are going to give that cough syrup also, doctor. And pelvic floor muscle exercise, we have to explain. Okay, we have to explain the patient that what how to do the pelvic floor exercise. Okay, explain what pelvic floor muscles and what they do. Okay, demonstrate and explain the squeezing and lift of pelvic floor. Recommend supervise pelvic floor muscle. We are going to refer for that one. Refer to we call it continuous physiotherapist, not physiotherapist. Okay, or a specialist. Okay, structured program for at least for 3 months. Okay, tell that you have to be regular and correctly perform exercise are the key factor of the success of the therapy, and combined with the neck. Okay, what you call it, contracting pelvic floor before and during coughing, lifting, or sneezing up. Okay, bladder training you have to mention, and pharmacological options are there. But first of all, we will be talking about non-pharma, then pharmacological. Pharmacological is not from our side. Pharmacological side is not from our side, that is from the specialist side. Okay, and when to refer, there are few red flags are there you have to remember. If patient when we are considering patient having red flag features, maybe she can't hold, there's a blood or something, whatever, so on, significant prolapse needing specialist management, persistent incontinence despite of at least 3 months of 3 months of pelvic floor muscle training, or adequate bladder training. Patient got failure is still not getting improved. We have to refer urgently. Okay, when we are going to refer normally. Okay, and medication trial. If like say you given any medication or patient already took the medication, now came to you, doctor, it's not working, we are going to refer. Okay, uncertain diagnosis. For example, if you're thinking that some neurological cause is there, maybe mixed or complex pattern is there, so you can't understand what's going on with the patient. Yes, you have to refer. Okay, and patient request for more definitive treatment. Don't hold that I'm going to give the medicine or treatment. I am okay. As per this, they say I'm going to refer you. That's it, doctor. But you have to explain from here. Mrs. Laila, we are usually starting with exercises and bladder training because many women improve with those. If after a few months that you are still struggling, and we can talk about medication and refer to your specialist team to look at further option, including surgery if suitable. Okay, so don't talk about surgery, but I'm just giving explanation. Okay, so this is the one you have to mention. So, doctor, anyone volunteer to do one
Doctor,
more case? Yes, doctor.
Dr. Imran, what physiotherapist you have told? What we should say?
Doctor, you can say that he or she will be giving you some exercises down below muscles.
So we can use the word physiotherapy.
Yes, doctor, we can use physiotherapy or muscle exercise. I will be sending you to muscle exercise specialist
Awesome exercise. Okay.
or muscle strengthening specialist.
Okay.
Okay, Dr. Sadar, Dr. Rumina, or Dr. Noor Jannat, and Dr. Kumar. Anyone is want to do the case? Should we stop over here? Okay, I think so. We will be stopping over here, and night session will be for April candidates. So we will be going as per the plan, inshallah. And thank you very much for joining, doctors. See you tomorrow. But tomorrow's timing will be a little bit upside down. So I will be Rolf in the evening. Okay, inshallah. Thank you.
Thank you, doctor.